The Oregon Health Authority reports that Black community members are being hospitalized for COVID-19 at much higher rates than their white counterparts.
Health officials say they're working to try to fix this. Fox 12's Bridget Chavez joins us now live after speaking with a senior health advisor for OHA. Bridget, what are the current vaccination rates for the Black community?
Yeah, well, we know that Oregon as a whole has reached about a 73% vaccination rate, but for the BIPOC community, that number is much lower. The Black community specifically is sitting right around 40%, and with the Delta variant spreading as rapidly as it is, it's more crucial than ever to reach these communities of color. As COVID-19 cases continue to skyrocket in Oregon, the most vulnerable in our communities are more likely to end up here.
It's spreading like wildfire, and those that are not vaccinated, i.e. Black folks, Hispanic folks, are seeing much higher hospitalization rates.
Dr. Bukosi Dubé is a senior health advisor with the Oregon Health Authority and says that those in the Black community are being hospitalized at a rate 5.5 times higher than white people.
Black folks have not been vaccinated at the same rates as white folks. The state as a whole is at about 73% or so for the entire state, whereas in the Black community, it's still in the 40s, 47, 46, 47.
So why does this discrepancy exist?
So we look at just not trusting the system because of systemic racism and continued systems that continue to oppress communities of color within the state, within the country, and also people not being comfortable seeking care early on when the disease hasn't progressed, when it can still be monitored.
And how can we close the gap? Dubé says it starts with building trust.
And if we don't act in ways that show that these are priorities, these communities are priorities, then we will not build that trust that enables people to just step up and come in and get vaccinated. We need to act in ways that shows these communities that we truly care about them.
Dubé says they're working with community-based organizations, churches, food banks, and going door to door.
Showing them that their questions are not going to be dismissed. Their concerns are not going to be dismissed. That their concerns are actually heard and taken seriously.
This outreach is crucial because Dubé says the Delta variant has changed the game of the pandemic and hospital beds are filling up fast.
Some hospitals are now on divert, meaning that they can no longer, they're so full that they can't take in new patients. You may end up being in an ambulance much longer or being shifted to other hospitals where they have space.
One more thing Dubé says is if you do have to be diverted to another hospital and you don't have your support system in place, that can also delay recovery as well. Reporting live in Beaverton, Bridget Chavez, Fox 12 Oregon.